This week, NHS England riled the nation's GPs, telling them they must now ask patients what goes on behind their bedroom doors. Yep, it doesn't matter if you're an 80-year-old grandma or a 16-year-old teenager. The state reckons it's entitled to know whether you sleep with men, women or both. Insulting, yes. Intrusive, of course, because a person's sexuality is their own private business. It's not their GP's, and it sure as hell isn't the state's. NHS England insists it's to comply with the Equalities Act, which says we're legally bound to ensure people who don't identify as heterosexuals aren't discriminated against. Well, if GPs don't know your sexuality, how can they discriminate against you? It'll come as no surprise that this directive follows a survey by the LGBT Foundation, which has been lobbying for 7 years to have this question asked. The survey, which offered people shopping vouchers to take part, talked to just 144 LGBT people and concluded that 90% of them, that's just 117 people, would be happy to disclose details of their sexuality. Well, bully for them. But what about the millions who wouldn't and who'd be horrified if their personal info was leaked by hackers or gossiped about by GPs, receptionists and clerical staff? I'm sorry, this Orwellian intrusion is nothing to do with the nation's health and everything to do with gutless politicians allowing social policy to be dictated by minority lobby groups and an effort to look right on. Here we go.
No, not at all. I mean, the end line I disagree with, you know, when we're getting to minority lobby groups. I mean, thank goodness we have them, otherwise we'd still have Section 28. But I do agree with most of what you said there. It's an absolute invasion of privacy. It's nobody's business. But I do think maybe what we need is much more sort of neutral terms. You know, when you go to hospital, you go to the doctor, there's the assumption that you are heterosexual. You know, they ask straight away, do you have a husband if you're a woman, and vice versa if you're a man? And maybe it should be much more... They do. Maybe it should be much more neutral terms.
If you had a problem...
But I don't think people should be forced to volunteer that information.
If you had a problem that related to your sexuality, of course you're going to tell your doctor about
Precisely.
that. I mean, you would.
No, but this is about prevention as well, and it's about the understanding that there's not a level playing field. So first of all, privacy is really important.
Doctors don't have a level playing field.
By the way, do you know what the choices are on this?
Yeah, I do.
Because you get a number of choices as to how you think you describe yourself, one of which is not stated because the person declined to provide a response. So the idea that we're forcing all these grandmas... By the way, I know some gay grandmas, don't you?
Let's go on with that. Not stated. That is put on your record. That's like a black mark. That actually says... What that says is non-compliant. That stays on your record forever if you...
So let me just finish the point about why I think, and I understand the concerns, and none of us like the idea of the state gathering intrusive data about us, and I'm the first person to say that, but it's a fact, and it's a serious fact, that people who are lesbian or gay or bisexual are at greater risk of certain public health conditions, and they have a higher risk of alcoholism, they have higher instances of self-harm, suicide. Right, so there is a kind of a patient-centred argument and a cost argument. That
and you think doctors wouldn't see that?
Well, you know, you might not have identified something that you need addressed, but the fact that you are gay makes it easier for that to be addressed. And secondly, the reason for this is a cost reason, that it's costing the NHS more to deal with conditions they feel could have been prevented if they had more information about the patient. So
doctors don't want
I think
this.
It's important to say that as the context.
Doctors have said this will destroy many long-standing relationships they have with patients.
Some doctors.
That's not true. Because
many doctors. That is true. It is true. For doctors have come out this week and said exactly that. It will destroy long-standing relationships with patients.
Though, our right to privacy overrides that.
I think they're competing, and I'm not saying that this wins, but I think that there are competing.
Surely, if you were saying this is compulsory, I agree with you. If you're saying, look, this is voluntary, you can put it on if you don't want. The problem is, I would agree with you, is what you said at the end. Once you pass anti-discriminatory legislation, you can only demonstrate if it's working or not. If you actually start collecting information. And I remember exactly these arguments in the job I was doing 30 years ago about whether or not you should ask people what their colour was. And in the end, everyone's come to the conclusion you have to.
There are still some people who don't like to declare, and again, you always have an option.
And it's quite interesting that
it
is the gay organisations, the organisations who
are pushing for this.
Who are pushing for it. Now, I'm not saying... I think... It all depends how it's done.
Can I
it all
just,
depends.
I just want to correct Carole quickly, because you said that GPs, just really quickly, you said that GPs are against it. The Royal College of GPs has said a patient's sexuality can have an impact on their healthcare, and it's helpful for a GP to know.
I don't have my piece of paper with
it's
me.
not fair that GPs have supported it.
There's been stories in the paper all week saying GPs being quoted as objecting.
There are some GPs that
and some who don't agree, and some who do.
Well, credit to you, I didn't realise that it was based on interviews with 144 people. I find that, and what I also find quite extraordinary about this very powerful lobby is that 2 weeks ago they were advocating on our census we shouldn't have to define our gender, we shouldn't have to put that, and now yet they want, the same lobby appears to want our sexual orientation the minute I fall off a ladder and break my wrist and it has to be set. I cannot see why that is. And I do think, and I do buy your point, that there will be something, and let's face it, the British by and large, we are very accepting of this. So if we get a form, we're probably, I hear you, Greg, but most people are decent. Oh, they want to know that I'm gay or I'm straight or whatever, whatever. I think in some instances it's going to lead to deterioration of the relationship between doctor and patient.
Well, it's not true, because of the last census, I think 5% put the religion down as Jedi.
Yeah, but that's quite small, isn't it?
They put their religion down as Jedi.
Yeah, there is a Jedi.
Also, there is a worry about security. The Information Commissioner said very recently that 1/3 of patients' information in the NHS is not secure. So just say you're a gay man or woman and you're married with kids and you haven't actually declared it yet. If the local GP's receptionist, anyone with access to a computer in a GP surgery can look at that information and maybe gossip about it. And the idea that you would think that that's an OK thing to do.
I don't know about you, Carole, but my GP has loads of personal information about me already. So if we've got concerns about what they're doing with our data, then I don't think this should
I don't want to
affect
turn
that.
on you, but why? What are we going to do once we get it? So actually, I discover that I'm gay or whatever. What does it matter? What do we do with it?
What it would tell researchers, I'm not saying I'm in favour. What it tells researchers, as you can see, is there any sort? Is this the norm and what's happening, and therefore is there any sort of differentiation in terms of the treatment, in terms of what happens to people who are recognised as gay and people who are not?
It's basic. But we can't monitor something if you don't have the data.
No, I think I agree with you. That what you're playing off all the time is what we're going to learn from this worth the intrusion?
That's I agree with you. We've got to grab here from someone who's where you are, Afua.
We think it's no more personal than any other question that you might be asked about your identity. Actually, what this means is that it means that you're counted, it means that you're included, it means that your needs as a lesbian, gay and bisexual person will matter and are valued by the NHS. And that's really, really important for lesbian, gay and bisexual people's mental health and sense of well-being.
Yes, you see, I'm offended by that. I'm totally offended by it.
That implies that they don't.
That their needs are not being met. What about the needs of everyone who isn't gay? What about them?
I'm offended by the idea.
He's not here to defend himself, so we must be careful. But the implication is that unless you state that you're gay, lesbian or bi, the NHS is not necessarily there to help you. That's the clear, and I would suggest that's a little unfair.
But gay people are suffering from some health problems at a disproportionate
rate. Well, they can tell the doctor.
No, they're not being met. Those needs aren't
so they can tell the doctor about it. That's what you go to see the doctor for.
You can't point to gay people. I'm sorry. Oh, you've got a problem with what? And you're gay? Oh, sorry. Next.
No, you really think a doctor would do that? Seriously?
No. But that's not what Afua was saying, and that's not what he's saying.
He's saying their needs must be met.
No, what Afua is saying is, particularly in the area of mental health, there are definitely increased rates of mental illness within the LGBT community because of the way they're discriminated against in society. But I think what he's missing a point in that there are also a lot of people within the LGBTQ. Oh God,
it's hard. I know.
No, it's not. I say this every day.
It's a hell of a battle.
LGBTQ. I've been saying it for the past year. And within the community who are not out. And also, this then forces people to come out. So I think there's also a slight lack of sensitivity.
It's not TQ, it's LGB in this context. It's not about transgender.
OK.
And I'm just going to quote the NHS because we haven't heard their official position. They say, collecting and analysing data on sexual orientation allows public sector bodies to better understand, respond to and improve LGB patient services, access, outcomes and experience. To me, I get the privacy concerns, but that's basic. You can't solve something unless you know the scale of the problem.
And how do you know people are telling the truth? You know, if I was gay and hadn't told people and I wasn't out, I'd lie.
OK, fine.
So you have data that doesn't mean anything.
Be able to help you.
This is the moment.
Not today.
It's 2017.
Not today.
Carole, give me a number.
OK, right.